Okay, this is Dr. Razi, and I'm here to help you to pass your MRCS Part B examinations. And we are discussing critical care, a critical care station, and specifically we are discussing acute pancreatitis here. Okay, so this is the second lecture in this station. Well, so we are going to see what are the next questions that the examiner is going to ask you now. The examiner is going to ask you about the differential diagnosis, okay? So what is the differential diagnosis for these symptoms or this scenario which he told you in the beginning? Number one, it is acute pancreatitis. Number two, it is acute cholecystitis. Number three, it is ascending cholangitis. And number four, it is a perforated viscous, okay? These are the four differential diagnoses for which the examiner is seeking. Okay, acute pancreatitis, acute cholecystitis, ascending cholangitis, and perforated viscous, okay? Okay, this question finished. Next, they are going to ask you the next question, what are the causes of acute pancreatitis? And let me tell you that there are tens of causes of acute pancreatitis. I think that anything in the world can cause acute pancreatitis, but please remember the commonest. Number one, you have to remember the gallstones. Number two, you have to remember chronic alcoholism, okay? Fine. These are the most important. Gallstones and chronic alcoholism, okay? In the third category comes infections, okay, in general. Okay, you can say infections alone, and you can mention the examples like mumps, like Coxsackie virus, like typhoid, and so on, okay? Another cause for acute pancreatitis is hypercalcemia, okay? It's a common cause here, okay? It could be due to hyperparathyroidism, it could be due to any other cause, but hypercalcemia is one of the known causes of acute pancreatitis. Could be direct trauma, okay? It could be iatrogenic due to operation or something like that, okay? It could be so in operations handling and manipulation may cause acute pancreatitis. Hyperlipidemia is another cause, okay? Most probably as you are going on, the examiner will stop you, but you have to know them all, okay? One of the most important causes are drugs, okay? And the most common drugs are corticosteroids and estrogen containing contraceptive pills, okay? Corticosteroids and estrogen containing contraceptive pills, okay? Well, there are other drugs that can cause that. Antibiotics, azathioprine, thiazide diuretics can cause this. Another cause of this acute pancreatitis is hypothermia, can cause acute pancreatitis, okay? Shock or vascular insufficiency can cause acute pancreatitis, and it could be due to a medical instrumentation. It is also iatrogenic, and it is a common cause like ERCP, okay? Is endoscopic retrograde cholangiopancreatography, okay? So these 10 causes are easy and you can remember them, but always remember the most important causes are gallstones and chronic alcoholism, okay? The next question will be tell us about the pathogenesis. How does this happen, this acute pancreatitis? Okay. And the pathogenesis, there are many mechanisms that are thought to be responsible here. We'll speak about the most important one. And the most common reason that leads to acute pancreatitis is pancreatic duct obstruction. Okay, so duct obstruction is the most common cause here, and the gallstones are involved here mainly. So what happens here? What happens here is that the duct, the pancreatic duct, this is the pancreas here, and the pancreatic duct going here to meet that. Bile duct, common bile duct, and this is the duodenum anyway, just to tell you. And there is an obstruction here. So whatever the cause, the secretions will move back inside the ducts. Okay, and the high pressure inside the duct here will cause the damage of the pancreatic acini. Well, and the pancreatic enzymes will leak outside. Okay, and this will cause further damage for the pancreas itself and for the surrounding structures. Okay, so this is one of the most common pathological mechanisms or pathogenesis for the acute pancreatitis. Well, let us go to the second type, and it's easy actually. It could be due to damage of the pancreatic cells due to viruses. Okay, fine. It could be due to bacteria. Okay, it could be due to what they call it, drugs, as we call them the causes, or it could be due to what they call it, trauma. Any of the causes that are mentioned after the main causes could cause it, and this is called direct acinar damage. Okay, it's a direct damage to the acini. Okay, well, another reason for the acute pancreatitis, or another pathological process that goes there, is the release of the proteases due to some reason, and actually it is released by one of the mechanisms that I mentioned before, damage and so on. Okay, well, we will go to another category here in the pathogenesis, and it is very important that there are many enzymes, as we mentioned before, and these points are crucial for acute pancreatitis, and they will happen and they will cause the situation worse. So proteases will damage the pancreas itself. So the acinar cells damage, proteases released, and the lipase also will be released here. Okay, lipase will cause fat necrosis. Okay, and another thing that will be caused by the lipase is something called calcium chelation. Calcium chelation. Okay, so there is something like what they call it, like yellow-white patches of calcium and fat. So fat necrosis occurs and releases free fatty acids, and these free fatty acids react with the calcium, and they cause what is called saponification. Okay, so this is the process by which this problem happens. Okay, so what happens else? There is an enzyme called elastase. This elastase is released from the pancreas itself. As you see here, pancreas is destroying itself. So elastase will destroy the elastin of the blood vessels. Okay, to destroy the blood vessels. And if you destroy the blood vessels, there will be hemorrhage, right? So depending on the degree of hemorrhage, it may be just an exudate, bloody exudate in and around the pancreas, and it could be something, or it may lead to something called acute hemorrhagic pancreatitis. Okay, this is because of the problem. So to make a long story short, in the beginning there should be an acinar damage. The first step for pancreatitis is an acinar damage. The acini should be damaged. Okay, how? No problem. So the acinar damage will release the enzymes. Okay, the pancreatic enzymes, and this will lead to further damage. This is the conclusion for the pathogenesis of acute pancreatitis. Okay. Well, I will see you in the next session in this part of the critical care station of acute pancreatitis.